Mr. Martin came into the ER because he was coughing up blood. After initially running tests to determine what is causing the problem, Mr. Martin is transferred to another unit to continue his care.
To get ready for the new patient coming to our unit, my job as a nurse is to set up the room by making sure it is clean, organized, warm, and well lit. Now that the room is in order, I am going to take a look at the new patient's medical records. I find out my patient's name is Mr. Martin and that he has stage 4 lung cancer.
Because Nurse Stacy is new to this unit, she collaborates with Nurse Nicole, who is also responsible for the care of Mr. Martin, to get a better perspective on the situation.
Nicole, I was wondering if you took a look at Mr. Martin's medical records because it says he has lung cancer, and I'm not sure if the patient is aware of it or not, and I have never been the first person to tell someone they have cancer.
I did look at his records and I was wondering the same thing too. We need to talk to his doctor to clarify.
Luckily, Dr. Stephanie, Mr. Martin's doctor, just walked into the room.
Dr. Stephanie, we are looking at Mr. Martin's medical records and it was unclear if he is aware that he has cancer. Can you clarify that for us?
Oh yes, sorry that is unclear. Mr. Martin is not aware of it yet, and I was just about to tell him. I think it is best that you're both there for support as well. How about you guys go in and greet Mr. Martin and check his vitals to see if there are any changes. I just need to review his records and lab results one more time, and then I'll come in so we can talk to him.
Okay.
Sounds good.
Hello, Mr. Martin. My name is Nicole and this is Stacy. We are going to be your nurses today. How are you doing?
I could be better.
That's for sure. Hi, I'm his wife, and all he does is mope around all day and complain about how he doesn't feel good, but no one around here seems to know what's wrong with him. We have been here for hours while you people run tests and we still don't have answers.
I am very sorry that it's taking so long, but we just need to ask you a few questions and check your vital signs to see if there have been any changes. The doctor will be here shortly to talk to you.
Nurse Stacy and Nurse Nicole asked Mr. Martin a series of questions to get a better idea of his health history. To gain knowledge of his mental status, they ask,
Okay, Mr. Martin, do you have any history of depression, anxiety, mental disorder, or anything like that?
Not that I'm aware of, no.
Excuse me, but he most certainly does. He's always so depressed and sad all the time, especially when a big roadblock gets in the way of anything. He just sits there by himself. He's tired all of the time. He doesn't talk to anyone and especially doesn't pay any attention to me. It's always about him.
Is this true, Mr. Martin? Are you often fatigued and feel sad?
I guess so. Sometimes.
The nurses record his answers, check Mr. Martin's vital signs, and record them.
All of your vital signs are stable and there is not any dramatic changes. Oh, and here's Dr. Stephanie.
Hello, Mr. Martin. I'm Dr. Stephanie, and I have some lab results here that I need to talk to you about. While analyzing your test results, the lab concluded that you have stage 4 lung cancer.
What's wrong with him? I can't understand you.
Mr. Martin, you have stage 4 lung cancer.
Wait, what? I'm still unable to understand you. What are you talking about?
I'm sorry, Mr. Martin, but you have stage 4 lung cancer.
Of course, just another thing to make him depressed all the time.
Alright, I'm going to let you take on all this information. The nurses will stay here with you in case you have any questions.
My option here is to freaking kill myself. There's no point in living. I can't jet ski, I can't snowboard, I can't ride quads anymore. What the hell?
Mr. Martin, I think you should try to calm down so that we can discuss this rationally. Nicole and I will be right here with you if you just want to talk about this, or we will answer any questions that you might have.
During this phase, there are 2 barriers and 2 bridges present. Mr. Martin's wife has a lack of empathy for her husband and does not provide the family support he is in need of at this time. But the nurse provides a bridge by therapeutically touching Mr. Martin's hand to let him know that she understands how he is feeling right now. Another barrier is the inability for Mr. Martin and his wife to understand what the doctor is saying. The barrier is bridged by the nurse clearly explaining what the doctor has said. When Nurse Nicole touches Mr. Martin's hand and stays at a comfortable distance away when talking to him, these are examples of nonverbal communication. An example of verbal communication is how Nurse Stacy talks in a soothing and calming voice to calm Mr. Martin down. When Nurse Nicole explains that her and Nurse Stacy are there for Mr. Martin to just talk, this is an example of being with from Swanson's theoretical view on caring. Now the nurses need to plan, explain, and implement the care for Mr. Martin.
Our first priority is to stop Mr. Martin from harming himself or others, and the best way to do this is to go to the doctor's order for restraint and keep him on close suicide watch.
The next thing we need to do is talk with Mr. Martin and his wife to discuss the treatment options best suitable for them. We can refer both of them to a therapist to talk about their feelings regarding his cancer, depression, suicidal thoughts, and we can also refer him for radiation therapy or chemotherapy.
Now that I see my husband's reaction to this diagnosis and I see you guys are trying to help, I'm willing to get help and support my husband in any way that I can.
I don't know. I just don't see any point in going on. What's the point?
We really would like to talk to you about these different options that you can take to get help. We encourage your involvement in your treatment so that you will be happy with what is going on in your life.
Encouraging Mr. Martin's involvement is an example of verbal communication. After months of therapy, counseling, taking prescribed medication, and chemotherapy, Mr. Martin is coming back to the hospital for a final checkup before his treatment is ended.
Hi, Mr. Martin. How are you?
I'm doing pretty well, actually. I'm a little tired, but the therapy and counseling has really been helping me deal with my thoughts and emotions.
It's helping me understand what he's going through as well. My husband and I have gotten a lot closer since we started talking with the counselor.
We are very glad to hear that. Today is your last checkup with us before you end your treatment, and we just want to make sure that you are happy with the decisions we have made together regarding your treatment.
Yeah, I'm happy with how things are going. My life has completely turned around, and I cannot thank you guys enough.
Dr. Stephanie wants me to remind you to continue taking your medication until you run out, which should only be another few days. Like Nicole said, it was a pleasure meeting you. Take care.
It was a pleasure to meet you, and we are very glad to help. We do recommend going to a support group for cancer survivors so that you can talk with people who have been through the same experience as you. And we wish you the very best in your future.